see this is the cross section here, is this one here. Okay, roughly in the middle.
Software puts that
No,
cross section there?
No, I move it. I move it with the wheel.
Oh, I see.
Okay, I put it roughly in the middle. So now I can look at the outline of the virtual tooth we just created.
Right.
I can look at the outline of the gum tissue. And this gives me an idea where to, and of course the nerve. This gives me an idea where to place my, my implant. Okay, so we're going to go to Plan Implants, Create an Implant, Place an Implant. And this is just arbitrary.
Does it have the implant quality, so that tells you what company and...
Yes. So now this is just, let's pick which implant you want to use. Let's use a Nobel, for example. Let's say we do Nobel, whatever, Nobel conical connection. Let's say we pick a 5 millimeter diameter by 11.5, reasonable dimensions. So we got the implant. Now, this is a little trick. Now we put an abutment on. Not an abutment in the conventional sense.
In the sense that it goes through the center of the crown to show.
Correct. So call it a conical abutment and make the color black. And it's going to be a diameter of, what's the axis screw hole? Let's say it's a 3.5 millimeter diameter, and I'll call it 15 millimeters height. So what you have...
poking out.
Yeah, it's going to poke out, and it's going to show us the trajectory of the implant.
And it'll show you how it's, where it's occluding against the top tooth.
Correct.
In that cross section.
It will, because we have the itero, which shows us the opposing. But that we keep for the end. That's the, let's call it the final touches. We don't need it right now.
Okay.
So the first thing that I do, I kind of look at the, this is now a buccolingual section. Okay, so I can tell, you can tell that it needs to be a little bit more lingualized in terms of the angle. Meaning in terms of not a little bit bodily movement, roughly. And then we'll go to the, now we have all the sections rotating around the implant. So this is going to be the cross section.
This is tangential. Where what did you click on to get that?
Right here. Here's the view. I can do a cross-sectional slice.
Right.
Which is just going to move along the arch. Or I can take the slice through the implant and then go and look at images where the implant is the center of the image.
Right.
So I can basically rotate the slice
and look at it, how it relates to
everything. And then you see the problem.
Angled
you see
to
this
the mesial.
Exactly. So this implant needs to be angled to the mesial for different reasons. Number one, for safety. Number two, for what we talked about before, for proper contours and contact points and embrasure spaces. And now we're in the ballpark, we're getting there, so we have to save it. That's pretty simple to do, and she has actually pretty good bone. She just has a soft tissue defect. Okay, let me take this off. Now I can put on the root surfaces and get rid of the gingiva. I mean, you will start seeing that in the ballpark, we're looking like this is a great position. And you correct me if I'm off. It's a great position. We can now be, we call it finessing. I don't think it needs much finessing, but it's pretty much where it's supposed to be. So this is what we're going to do. It's almost parallel to the adjacent roots. It's parallel to, we can kind of look at it and measure, put some lines. It needs to be parallel with the contacts or the proximal areas of the adjacent teeth. That's what we would like. And it needs to be within the confines of the bone. It needs to be far away from the nerve. So we're going to check all these things now. So look what's happening here. You see, we're a little bit closer to the lingual concavity. You see this here? This is buccal, this is lingual. And I'm not saying this is an issue, but let me see. I'd like it to be more in the middle of the ridge.
Right.
Okay, if I can.
So you could tip it, you could bodily move it.
I can bodily move it. I'm pretty sure. You see, it's tricky because you see the concavity here. Here's your concavity. Right here. So let's see. So let's put the restoration back on. The bone doesn't interest us. Okay, so let's do the following. Let's move it to the
That's from
buccal.
your 3D window that you put the soft tissue back on? You
I'm sorry?
When you wanted to see just the roots and take away the bone, it's on your 3D window?
It's here, it's on the 3D.
Yeah.
They did some
Okay.
rendering. And now I moved it bodily to the lingual. I'm sorry, to the buccal. And I'm going to tilt it a little bit to the lingual. And if you see something that you don't agree or don't like, you let me know. But I want it a little bit more centralized in the ridge without compromising and I think we're getting there, without compromising the prosthetic position.